How are complex cystic fibrosis cases finally diagnosed? Imagine trying to solve a puzzle where some pieces are missing or don't quite fit. That's often what doctors face when diagnosing complex cystic fibrosis cases. These are situations where standard tests don't give a clear answer, so a more detailed approach is needed. Most cystic fibrosis diagnoses start with newborn screening, which checks for elevated levels of a substance called immunoreactive trypsinogen in the blood. If levels are high, it raises suspicion but isn't enough to confirm the diagnosis, because other conditions can also cause high levels. The next step is the sweat chloride test, which measures how much salt is in a person's sweat. If the chloride level is 60 millimoles per liter or higher, it strongly suggests cystic fibrosis. But sometimes results are borderline or intermediate, especially in complex cases, so doctors may need to dig deeper. Genetic testing is also a key part of the process. Usually, panels test for common mutations in the cystic fibrosis transmembrane conductance regulator gene, but these panels can miss rare or unknown mutations, especially in people from diverse backgrounds. That's why in complex cases, doctors often perform full gene sequencing, which looks at the entire CFTR gene to find rare deletions, duplications, or mutations that standard tests might miss. Some patients have symptoms that point to cystic fibrosis but have normal or borderline sweat test results and negative genetic panels. This makes diagnosis tricky. To get more clarity, doctors may repeat the sweat test to see if results change over time. They also use functional tests like nasal potential difference measurements, which assess how well the CFTR protein works in the nasal lining. If the channels aren't functioning properly, it supports a cystic fibrosis diagnosis. Monitoring clinical signs is also important. Lung function tests, such as spirometry, help track breathing ability, while imaging like chest scans can reveal lung damage or mucus buildup. Tests for pancreatic function, such as fecal elastase levels, can show if the pancreas is affected, which is common in cystic fibrosis. When results are still uncertain, some patients are classified as having cystic fibrosis-related metabolic syndrome or CF screen positive, inconclusive diagnosis. These individuals need close follow-up to watch for changes over time. Diagnosis in complex cases is usually made at specialized cystic fibrosis centers, where teams of experts interpret all the clinical, genetic, and functional data together. Genetic counseling is also recommended to help families understand the implications of different mutations and plan for the future. In summary, diagnosing complex cystic fibrosis cases involves a combination of repeat and expanded sweat testing, comprehensive genetic analysis, functional assessments like nasal potential difference testing, and ongoing clinical evaluation. This thorough approach helps ensure an accurate diagnosis, which is essential for providing the right care and monitoring tailored to each person's unique disease profile. Always remember, if you or someone you know is facing this situation, consulting healthcare professionals who specialize in cystic fibrosis is the best step forward.